I have the honor today to share with my dear professors and dear colleagues this great international conference of psychiatry at Shams University. Also, I have the honor to share with my dear colleague, Professor Mohammed Fikri, this session about traumatic brain injuries. My talk today will be about the neurological aspects of traumatic brain injury. Traumatic brain injury primarily refers to brain dysfunction caused by external trauma from a violent blow to head or body. The degree of damage can depend on several factors, including the nature of the injury and the force of the impact. TBI can affect anyone at any age and may lead to several complications and disabilities in the future. It is the most frequent cause of hospitalization in young people with a higher prevalence in men. Traumatic brain injury is the leading cause of disability and mortality between the age 1 and age 45. It can be caused either by the direct result of trauma or due to a complication of the primary injury. Annually, 10 million people are affected by traumatic brain injury all over the world. Falls are the most common reason for sustaining TBI in children aged from 0 to 4 years and elderly aged 75 years or older. According to the Centers for Disease Control and Prevention, CDC, falls contribute to 40% of the total traumatic brain injury. Other common causes are motor vehicle accidents, representing 14.3%. Sports injuries may cause traumatic brain injury very frequently, especially from some types of sports such as boxing, baseball, skateboarding, and other high-impact or extreme sports. Explosive blast and other combat injuries are a cause of traumatic brain injury, which results from pressure wave passing through the brain, significantly disrupting the brain function. Whom are at risk of TBI? TBI can affect anyone at any age, leading to severe complications and disabilities in the future. Especially children, especially newborns up to 4 years old, young adults between 15 and 24 years old, older age 75 years or more. Regarding the risk factors that aggravate traumatic outcome includes age, coexisting medical disease such as hypertension, existing tumor, repeated trauma, and anticoagulant drugs. What about the classification of the traumatic brain injury? We can classify traumatic brain injury into different classifications, either primary and secondary or focal and generalized. Regarding the primary and secondary injuries, primary injury induced by mechanical force and occurs at the moment of injury. The two main mechanisms that cause primary injury are contact, an object striking the head, and acceleration, such as acceleration, deceleration. Regarding the secondary injury, it's not mechanically induced. It may be delayed from the moment of the impact and may be superimposed the injury on the brain already affected by the mechanical injury. Regarding focal injury, it includes the scalp injury, skull fracture, surface contusions generally caused by the contact. On the other hand, the diffuse injury includes diffuse axonal injury, hypoxic ischemic damage, meningitis, vascular injury, usually caused by the acceleration deceleration forces. This graph showing us the different types of injuries, either primary or secondary. Usually the secondary injury can be a result of different defects such as oxidative stress, disrupting blood-brain barrier, inflammation, excitotoxicity by glutamate, NMDA receptor overstimulation, calcium influx, and decreased synaptic dysfunction, ending with cell death. How to measure the severity of the traumatic brain injury? We can use Glasgow Coma Scale, which is considered an important scale to assess any disturbance in consciousness. Duration of loss of consciousness classified as mild. Mild means mental status change or loss of consciousness less than 30 minutes. Moderate means that mental status change or loss of consciousness 30 minutes to 6 hours. Severe means mental status changes or loss of consciousness more than 6 hours. Also, we can assess by the post-traumatic amnesia, The time elapsed from the injury to the moment when patients can demonstrate continuous memory of what is happening around them. Regarding the pathophysiology of traumatic brain injury, it can cause different changes such as cerebral edema, cerebral hypoxia, ischemia, cerebral metabolic impairment, cerebral vasospasm, and increased intracranial tension. Also, there is increased glutamate, mitochondrial dysfunction, and impairment of glucose metabolism. Also, blood-brain barrier and increased excitotoxicity, and may lead, and in the end, to cell death. There are many different types of traumatic brain injuries. Number one, concussions, which is the short loss of consciousness. Concussions remain prevalent among athletes who have an increased risk of repeated injury. Similarly, boxing may cause concussions from a blow to the head by the fist, causing the tear of bridging veins, subdural hematoma, ending in subdural hematoma or microhemorrhages in the brain, and diffuse axonal injury. Also, another type, which is the penetrating injuries, foreign body or foreign object enters the brain. Also, another type, closed head injuries. Also, skull fractures, bone fractures or breaks, hematomas, bleeding in the brain, laceration, tearing of the blood vessels or tissue, anoxia, absence of oxygen supply to tissue. Contusions, bruising of brain tissue, and diffuse axonal injuries may lead to a breakdown of the neuronal connections. Pathological studies of coma patients with diffuse axonal injuries tested through CT, MRI, and showing widespread white matter axonal damage. Also, diffuse axonal injuries and damage results from severe acceleration or deceleration of the head. Patients who have sustained severe diffuse axonal injuries are typically unconscious from the moment of impact. They do not experience lucid interval. Instead, patients remain unconscious or severely disabled until death. Even if patients survive diffuse axonal injuries, persistent neurological deficits remain throughout their lives. What is the pathological presentation of traumatic brain injuries? Macroscopically, it appears as focal lesion in the corpus callosum, which appears as clusters of petechial hemorrhages and could lead to intraventricular hemorrhage. TBI also involves petechial hemorrhages in the brainstem. More severe damage results in hemorrhagic softening of the dorsal part of the midbrain. The long-term survivors of diffuse axonal injury typically showed marked cerebral atrophy, dilatation of the lateral and third ventricle, and thinning of the corpus callosum. Microscopically, it showed diffuse damage to axons in the corpus callosum, superior parasagittal, cerebral, white matter, brainstem, and various tracts. Regarding the short-term complications of traumatic brain injuries include cognitive impairment, difficulties with sensory processing and communication, immediate seizures, hydrocephalus, CSF leak, vascular or cranial nerve injuries, and also tinnitus, organ failure, and polytrauma. The polytrauma may include pulmonary, cardiovascular, GIT, dysfunction, fluid and hormonal imbalance, deep vein thrombosis, excessive blood clotting, and nerve injuries. Also, TBI patients tend to have increased metabolic rate, which leads to an excessive amount of heat produced within the body. Also, brain swelling occurs secondary to the TBI and contributes to increased intracranial pressure as a result of cerebral vasodilation and increased cerebral blood flow. Regarding the clinical presentation of TBI, altered consciousness, one of the most important clinical presentation of traumatic brain injury. It can be moderate to severe according to the affection resulted from the degree of traumatic brain injury. It results in prolonged or permanent changes in a person's state of consciousness, awareness, or responsiveness. There is different states of consciousness, including coma. This results from widespread damage to all parts of the brain. After a few days to few weeks, a person can emerge from a coma or enter a vegetative state. Vegetative state, it is a widespread damage of the brain, result in this clinical presentation, although the person is unaware of the surroundings, he may open his eyes, make sounds, respond to reflexes, or move. It's possible that a vegetative state can become permanent, but often individuals progress to a minimally conscious state. Minimally conscious state, it is a condition of severely altered consciousness, but with some signs of self-awareness or awareness of one's environment. It is sometimes a transitional state from coma or vegetative condition to great recovery. Last, the brain death, when there is no measurable activity in the brain and the brain stem. This is called brain death. In a person who has been decelerated brain, declared the brain dead, removal of breathing devices will result in cessation of the breathing and eventual heart failure. Regarding the neurological complications, seizures, one of the important complications of traumatic brain injury. It may occur only in the early stages or years after the injury. Recurrent seizures are called post-traumatic epilepsy. Hydrocephalus, CSF may build up in the cerebral ventricles of some people after traumatic brain injuries, causing increased pressure and swelling in the brain, means edema. Skull fractures or penetrating wounds can cause infections because the tape in the layers of meninges that surround the brain can be a source of transferring infection from outside to inside. This can enable bacteria to enter the brain and cause infections, and infection of the meninges could spread to the rest of the brain. Regarding the blood vessel damage, it could be small vessel damage or large vessel damage in the brain may be present and can be a cause caused by the traumatic brain injury. This damage could lead to stroke or blood clots, hemorrhages, or any other problems. Headache is always can be very frequent and very common presentation of traumatic brain injury. They begin within a week after the injury and could persist for as long as several months. Vertigo, many of the people experience vertigo and the condition characterized by dizziness after the traumatic brain injury. Sometimes any or several of these symptoms might extend for weeks to a few months after a traumatic brain injury. When a combination of these symptoms lasts for an extended period of time, this is generally referred to as persistent post-concussive symptoms. Traumatic brain injury, especially at the base of skull, can cause damage to different cranial nerves, resulting in paralysis of the face when affected facial nerve, or loss of all alteration in the smell or taste, loss of vision or double vision, maybe bulbar problems, dizziness, vertigo, tinnitus, and hearing loss. On the other hand, intellectual problems can be one of the important symptoms may be following traumatic brain injuries, like cognitive problems, memory, learning, judgment, attention, executive functioning problems such as problem solving, multitasking, planning, and communication problems regarding the language and communication problems are common following traumatic brain injuries. These problems can cause frustration, conflicts, and different problems. Sensory problems include difficulty recognizing objects, blind spots or double vision, bitter taste or bad smell, or any skin tingling or itching, and trouble in balance or dizziness. On the other hand, the long-term complication of traumatic brain injury include degenerative brain disease. There is a relationship between the degenerative brain disease and brain injuries, and this is can be considered that this relationship is present, but some research suggests that repeated or severe traumatic brain injuries might increase the risk of degenerative brain diseases. This risk can be predicted for an individual, are still investigating, and still this issue is still under investigation, if, why, and how traumatic brain injuries might be related to degenerative brain diseases, which include Alzheimer's disease, Parkinson's disease, dementia, and different type of cognitive decline and impairment and problems. Other long-term complications include post-traumatic epilepsy, post-traumatic headache, especially tension headaches are the most common form, but exacerbations of migraine-like headaches also is frequent, sleep disturbance, and psychiatric complications. What are the symptoms of children when there is a traumatic brain injury? What are the symptoms which are presented in children? Infants and young children with brain injuries might not be able to communicate headaches or sensory problems, confusion, and similar symptoms. In a child with a traumatic brain injury may observe change in eating, nursing habits, unusual or easy irritability, persistent crying, inability to eat, change in ability to pay attention, sleep habits changes. This figure shows us to conclude that traumatic brain injury, either caused by blunt force, shading, or penetration, resulting in any type of head trauma that affects the normal functioning of the brain. Either present with mild symptoms, may include temporary loss of consciousness, headache, confusion, dizziness, fatigue, memory loss, and speech problems. Victims may suffer from light sensitivity, blurring or double vision, changes in taste and smell, and vertigo. Tinnitus also may be a symptom of traumatic brain injury. On the other hand, the severe symptoms include loss of consciousness from several minutes to several hours, persistent painful headache, numbness, seizures, convulsions, dilate pupils, and motor deficits. Victims can also suffer from cognitive impairment and speech disorders. How to measure the outcome of traumatic brain injury? Either by the functional independence measure, which is an item formed of 18 item scale used to assess the patient's level of independence in mobility, self-care, and cognition. And also we can use the stability rating scale, which measures general functional changes over the course of the recovery after TBI. Regarding prevention, seat belts and airbags, also always wear a seat belt in the motor vehicle. A small child should always sit in the back seat of a car, secured in a child safety seat or booster seat that is appropriate for his or her size and weight. Avoid drug abuse. Don't drive under the influence of alcohol or drugs, including prescription medication that may impair or affect our ability to drive because of disturbed or inability to concentrate, causing any type of confusion. Wear a helmet while riding a bicycle or motorcycle. Also wear appropriate head protection when playing baseball or contact sports, skiing, skating, snowboarding, or riding horses. Pay attention to our surroundings. Don't drive, walk, or cross the street while using phones, tablets, or smart devices. This distraction can lead to accident, falls, and traumatic brain injury. Thank you very much.